Carboplatin. Carboplatin is a chemotherapy drug that is pharmacologically classified as platinum-containing compound. It is a moderate to highly emetogenic agent depending with the dosage. Mode of action. Carboplatin causes cross-linking between and within the DNA strands, which prevent the cell from dividing and thus inhibiting DNA, RNA, and protein synthesis. This eventually leads to cell death. Patients. Carboplatin is used as a single agent or in combination in management of the following cancers: ovarian cancer, lymphomas, germ cell tumors, head and neck cancers, small cell cancers, endometrial cancers, relapse and refractory acute leukemia. Excretion. Almost 70% of carboplatin is excreted unchanged via urine. Thus, in case of impaired kidney function, the dose should be adjusted accordingly. Carboplatin premedication. Premedication drugs are used to prevent immediate hypersensitivity reaction from the drug. 2. Chemotherapy-induced nausea and vomiting. These premedication drugs include corticosteroids, that is dexamethasone, histamine 1 receptor blockers, that is chlorpheniramine, diphenhydramine, loratadine, and 5-hydroxytryptamine 3, that is 5-HT3 receptor antagonist, that is ondansetron, palonosetron, and we also have neurokinin 1 receptor antagonist, that is fosaprepitant and aprepitant. These are used when the carboplatin dose AUC dose is more than 4. Common side effects include increased risk of infection, feeling tired and weak, increased risk of bleeding, nausea and vomiting, soreness of the mouth and throat, hair loss, especially with higher doses, changes in kidney function. Less common side effects include peripheral neuropathy, feeling numbness, tingling, or pain in the hands and feet, decreased hearing or ringing in the ear, diarrhea, changes in liver function, changes in the taste of food and drinks. Dose-limiting toxicities: myelosuppression, which is characterized by neutropenia, anemia, and cytopenia. Hypersensitivity, which is characterized by dyspnea, hypotension, bronchospasm, urticaria, and erythematous rashes. Drug interactions: aluminum-made needles and infusion cells should be avoided, for they cause plaque precipitate when they come into contact with carboplatin. Aminoglycosides, that is gentamicin, neomycin, and amphotericin B. Concurrent use with carboplatin may result in the increase of nephrotoxicity and oxotoxicity. When carboplatin and paclitaxel are used in combination, paclitaxel should be administered first. This will ensure that there will be no delay in paclitaxel excretion, which leads to paclitaxel toxicity. Dose reduction is advised when radiotherapy and carboplatin are administered concurrently. Carboplatin dosing is based on renal function, which is determined by the measure of the estimated glomerular filtration rate. This minimizes the carboplatin toxicity while increases the therapeutic efficacy. Calvert formula is the most commonly used formula in calculating carboplatin dose. Preparation of intravenous solution. Carboplatin is available as a premixed aqueous solution, which is 10 mg per ml concentration. Diluents: 5% dextrose in water, or 0.9 sodium chloride injection. The final concentration should range between 0.5 and 2 milligrams per ml. Infusion time should range between 30 and 60. Note, carboplatin infusion time decreases hypersensitivity reactions. Here is an example of calculation of the diluent that is required. Patient ZY received per-carbo regimen. The dose of carboplatin is 450. How much of the diluent do you require? The minimum, what you can do, you can pause the video and you see the calculations. What does this mean? For carboplatin, 450 milligram, it should be further diluted to between 225 and 900 mils of diluent. These are references. Kindly share this video, subscribe, hit the like button, and help us grow.